Good afternoon. My name is Dr. Rula Elsarag, and as the director for the Baker Institute's Center for Health and Biosciences, I would like to welcome you to today's event, Boosting Brain Health and Wellness. The Center for Health and Biosciences, also known as the CHB, employs comprehensive research analysis to develop health policy recommendations that promote health and well-being in the United States and around the world. Brain health disorders like Alzheimer's and depression have profound impacts on public health and ultimately critical implications for the state's economy. The CHB, through the work of Dr. Harris Eyre, our fellow in brain health, is committed in its investment in brain health research and policy to meet the complex challenges of modern society and foster innovation. Furthermore, the Rice Neuroengineering Initiative is a collaborative multidisciplinary program that brings together experts that focus on advancing and extending brain health. The CHB in this webinar today will bring together health experts and leaders from government, industry, and the nonprofit sector to explore the potential role of a brain health institute in the state of Texas to boost the state's economy and improve health and wellness. I would like to first introduce our first speaker, Ambassador David Satterfield, who is the director for the Baker Health Institute and has over 40 years of experience in and leadership, diplomatic and leadership experience, including ambassador to Turkey and Syria. Ambassador Satterfield has been a strong supporter and advocate for CHB's commitment to brain health. I'd like to welcome Ambassador Satterfield to discuss the importance of whole of society brain health public policy.
Thank you, Rolla. Welcome and thank you all for attending this webinar. Brain function is essential to every aspect of life, and regardless of whether our brains are healthy or we are living with a disorder, our interest in the brain and brain wellness is growing, notably in the realm of public policy. Researchers have shifted in their thinking about mental health, primarily in terms of psychiatric disorders, to thinking about overall brain health, a broader category that considers healthiness as well as disease. A recent brain health survey from the Dana Foundation and Research America found that more than 8 in 10 Americans are affected by brain health issues. Americans consider brain health to be among the most important health issues. Overall, Americans say that they are not knowledgeable about brain health research. Americans have high levels of trust for doctors, researchers, and health professionals. Americans are curious, hopeful about brain health research, although still somewhat cautious. And most Americans support increased investment in brain health research with greater patient engagement. Everyone stands to benefit from others' cognitive well-being. Employers have a self-interest in keeping their employees healthy, productive, and filling their openings with high-performing individuals. Workers seek jobs that pay decent wages, provide purpose, and offer the chance to grow. Employers need workers who can keep up with the demand for new skills in this world of rapid technological change. We believe that encouraging brain healthy behaviors promotes a more prosperous, inclusive economy. Brain health issues are global, and the most impactful solutions do not lie at the level of the individual, nor at the health service level. They require public policy engagement and decisions. Because individual choices are influenced by a larger social and environmental context, policymakers should adopt a multifaceted approach to encourage healthy lifestyles and promote brain health. So how can we effectuate change? We can turn to state-level actors. State policymakers are well suited to align diverse groups of stakeholders from various fields, from patient advocacy, clinical care, public health, public policy, economics, startup, and private business. There are opportunities to address brain health at the national level. 3 out of the 5 current priorities for the U.S. Surgeon General relate to brain health, those being health worker burnout, workplace well-being, and youth mental health. The issues of youth suicide, depression and anxiety, and Alzheimer's disease also require solutions from the federal government. Cooperation remains critical as well among global actors. Research activity on brain health is occurring all over the world, but it needs to be centralized. Rice University's Baker Institute is uniquely positioned to assist in this effort. Why us? Our expertise spans clinical care innovation, public policy, and health economics in our Center for Health and Biosciences. Dr. Harris Arr is the Institute's new fellow in brain health. He is a global leader in brain health public policy and leads the Brain Capital Alliance. That's a global public-private people partnership. Harris co-leads the OECD Neuroscience-Inspired Policy Initiative and engages major think tanks, such as Brookings, and international organizations, such as the United Nations and the World Health Organization, on these topics. The Institute's global proximity and relationships with the Texas Medical Center provide us with a comparative advantage to other health policy research organizations. And of course, we are present as part of Rice University, which has a leading neuroengineering initiative. The passage of Texas House Bill 15 would allow the Baker Institute to establish a brain health hub. Our Center for Health and Biosciences would serve as a nexus to coordinate stakeholders at the state, national, and global levels. These relationships would drive new data and policy projects. However, this undertaking requires unity among stakeholders and a strong commitment from the top down. You're going to hear from experts and leaders in the field on how to improve brain health and why it is vital to population health here in Harris County, in Texas, in the US, and around the world. And with that, I will pass it off to you, Reggie. Thank you.
I would like to introduce our next speaker will be Reginald DesRoches, who is the president of Rice University and a Baker Institute Rice Faculty Scholar. He has also served as Rice's provost and dean of engineering at the George R. Brown School of Engineering at Rice. As a strong advocate for Rice University's neuroengineering initiative, he will discuss Rice's neuroengineering innovations. Welcome.
Thank you, Rolla. Can you hear me fine?
Yes.
Great. Thank you very much for the opportunity to talk about the neuroengineering initiative here at Rice. The initiative is around 4 years old, and it's quickly become one of the most important, one of the most exciting, and certainly one of the most impactful initiatives that we've had at the university. Here we see some of the faculty involved and the collaboration that's taking place. In particular, right now, we have strong collaborations with Baylor College of Medicine, Houston Methodist. You see there are several faculty that have joint appointments with Baylor currently in UT Health, as well as MD Anderson. And we are in the process of doing some joint hires with several of these institutions in the neuroengineering, neuroscience space. So what is neuroengineering? Simply put, neuroengineering is using engineering tools and technologies to restore, to reproduce, and to enhance brain function. And one of the reasons why Rice and also why neuroengineering is such a new and exciting field is because of certain technologies which have come online in recent years, which have allowed us to really understand brain function, but also enhance brain function. They include nanotechnology, the ability to build devices and tools at the nano level. Clearly, data science, machine learning, signal processing, and AI is transforming all fields. I think this will be the field that will be transformed more than any other field, just because of the amount of data that's produced by looking at the brain and interrogating the brain, as well as imaging and nanophotonics. These are all areas that Rice are very strong in. When we look at the basic technologies and science associated with these fields, along with the exceptional talent across the street and the Texas Medical Center as in the institutions and the clinicians listed here, we have the ability to do some just truly incredible work. So let me highlight just two quick projects. One is the lab of Jacob Robinson, who's one of our faculty at Rice. He is building exceptionally small devices, as you see here, this roughly the size of a grain of rice, that will perform neuromodulation to really address a range of mental health disorders. What's exciting about this, it doesn't require an external power source, so it can be embedded in the brain and function without a power source. And he's shown that you're able to to do this in mice. Jacob has left rice for a period of time to begin pursuing a startup company that's gaining an incredible amount of interest amongst funders throughout the state of Texas and throughout the country. And we are just truly excited about the impact that this work will have as he begins to translate some of this work. The other exciting project is from one of our new faculty members who we recruited from UT Austin a couple of years ago. He has the ability to put these arrays at a scale that nobody else in the world can do. So he has 1,000 electrodes in the space of roughly a grain of rice that can measure and measure the activity in the brain at a scale that we've never been able to do before. And so these are truly exceptionally small electrodes that really allow us to go at the cellular level. And again, this is the kind of work that's going to allow us to have an understanding of the brain that we've never had before. And so it's 200 times denser than ever previously recorded. And so again, technology such as nanotechnology and advanced materials allows us to do things now that we couldn't do prior to now. So in summary, it's in a short time, it's been an exceptional success in terms of the types of work that we've done, collaboration with the TMC, and I think this will be one of the most important fields in the coming years. And engineering and technology is rapidly changing our understanding of the brain. So thank you.
Thank you very much for highlighting this very important and critical work of the Neuroengineering Initiative at Rice. Our next speaker, we are very honored to have Mr. Jim Hackett, who is the trustee of Rice University and trustee of Baylor College of Medicine. He's co-founder of the Hackett Center. He has served on the boards of many public and private companies in the state of Texas. Most notably, he and his wife Maureen have funded and founded the Hackett Center for Mental Health to push for policy analysis and legislation in Texas. Mr. Hackett will be discussing why brain health is important to the private sector and the Texas economy. Welcome. Thank you.
Thank you, Rolla. I'm pleased to be with everybody here today. And it's been a long journey on the mental health front for our family and for many people in our country and around the world. And I'm really honored to be with a bunch of people dedicated to continuing that journey and making it ever more successful. I remember the days back when we were voluntarily adopting mental health parity amongst a bunch of companies in Houston, and Houston kind of led the way in that volunteer effort because a number of us had realized very early on that the productivity improvements from addressing mental illness in this case were just extraordinary. So that actually creating better healthcare plans to address mental illness was a really, really good business proposition. We're now on the forefront now that stigma is becoming less of an issue, which it was a huge issue back then. We're on the forefront of actually looking at not only mental health illness, but also mental health and how we optimize mental health. And I see this HB 15 and the opportunity to perhaps establish a brain health institute at Rice is a really interesting and compelling opportunity for businesses to address not only human flourishing of their employees, but also enhancing their capability to get the most out of people while they're in the four walls of their work environments. And I'm particularly interested in having more research be done about what kinds of things we do in work routines and work design spaces that will enhance the productivity of employees. Simple things like lighting. We all know that it's great to have good natural lighting. It'd be really interesting to know, like, in what way does that actually impact brain health and productivity? It'd be very interesting to know, well, at what points during the day should we say to people, get off your computers, because there's proof, there's established science behind why you want to get up for 5 minutes, stretch, maybe put your hands up, not just at your side, not sit somewhere. All those kinds of things to establish better brain health, not just addressing mental illness, are really intriguing to me. Rice is really well situated, along with its involvement with the TMC to do that. We've been, as a state, I know that we have the great benefit of a number of the associations that people on this call have. One of those is the Meadows Mental Health Policy Institute up in Dallas, which has been a big proponent of HB 15. We know that the next frontier for mental health is really in the policy making arena. And we know what CPRIT did when we had a similar significant effort on the part of the state to advance something very important to the future of humanity. This squarely fits HB 15 within that space, and I think has every chance to deliver on the promises and investments that CPRIT has made in the state of Texas. So I hope that all employers work with the very important and successful institutions in the nonprofit side in the state of Texas to make this next frontier happen more quickly, or as quickly as we possibly can. So thank you.
Thank you very much for this vital information. I would also like to announce that Representative Tom Craddock is unable to join us today. It's a very busy time at the Texas Capitol. We appreciated his intent to be involved. We're going to move on to our next speaker, Dr. Huda Zogby, who is a professor in the Department of Pediatrics, Molecular and Human Genetics, Neurology and Neuroscience at Baylor College of Medicine. She's also an investigator at the Howard Hughes Medical Institute and the founding director of the Jan and Dan Duncan Neurological Research Institute at Texas Children's Hospital. She is an award-winning pioneering neurologist with significant contributions to the field of neurogenetics. She is here today to discuss why this initiative is vital to Texas neuroscience leadership. Thank you.
Thank you, Rola. And I'm really honored to be joining this wonderful panel. And hopefully together we can really build a brain health research initiative in Texas that's transformative. What I thought I'll do in the next 5 minutes is share with you the challenges that we face regarding brain health and the opportunities that really make Texas the ideal place to solve some of these challenges. So just to start, it's important to recognize the number of diseases that affect the brain in Texas only. We are 30 million people, but if you combine neurological, traumatic, and substance use disorders, as well as psychiatric disorders, 18.7 million of our population might suffer one of those during its lifetime. So it's really a pressing need. And more importantly, to just maybe take one of those diseases, Alzheimer's disease, there are 5 million Americans, but about 10% of them are in Texas. If you look at this map, you will notice that the density of Alzheimer's disease in Texas way outweighs other regions of the country. This is why we need to understand why. We need the research to figure out why is the rate of Alzheimer's disease so high here? What can we do about it? Regarding mental health issues, I just want to show you this really chilling slide that's about data for admissions to the emergency room by young youth, by children and adolescents under 18 who come to the emergency room at Texas Children's Hospital, affiliated hospitals. So these are different campuses, but this is all of them combined. And you'll see up to about January 2020, it used to be somewhere between 20 to 50 visits a month. Fast forward to today, it increased during the pandemic, and it's now at 454, and the numbers have not been going down. We need to understand that. We need to understand what changes in the environment can affect the mental health of our youth, because when it's environmental, we can study it, we can develop intervention, as we just heard from Mr. Jim Hackett. So with those challenges, why are we positioned to really solve many of these problems? Texas scientists are truly leaders in identifying the causes of brain disorders and setting the stage to find new treatments. And I'm going to share some examples for you that I want you to hopefully leave this webinar realizing these are strengths in Texas. I'm not saying these are strengths everywhere around the country. There are some things unique to us, and we should capitalize on them. One of those is solving the unsolvable brain diseases. Typically, many children may have autism, may have intellectual disability, may have an unsolved disorders. They come to us, we study their DNA. As you heard, this is the #1 genetics program in the country. We should celebrate that. Today is DNA Day, by the way. And through artificial intelligence, collaboration throughout the medical center, we can narrow down the sequence abnormality to a handful. But that's where the rest of the country gets stuck. All of us have changes in our DNA. If you only have 2 to 3, you don't know which one causes the disease. What we have here, we are the leaders in the world on using fruit flies to solve human brain disorders. We know how to engineer them. We know how to put human variations in them to determine which of all the variations our DNA are bad, they cause disease. And this is why the NIH designated us here at Texas Children and Baylor as the model organism screening center for the whole country. We're helping people at all hospitals around the country solve these diseases. This is a gem. We have that in Texas. And then that would lead us to understanding pathway to develop therapies. Using that now, we're moving into new directions through a collaboration between, as you'll see below, many medical center institutions. We want to tackle Alzheimer's disease. Everybody assume all Alzheimer's patients are the same. They're not. They're very heterogeneous. We need to define the different types of Alzheimer so that clinical trials will be much better, so that you don't see as little benefit from clinical interventions as you're seeing now. This is one example where this technology, going from human through computation, through genetics, all the way using fruit flies to solve unsolvable problems. And a new initiative also unique to Texas, and that's why it's called the Texome Project, is one that specifically addresses disparities in genomic medicine. You may not recognize this, but people who are on Medicaid or people who do not have insurance don't have the same privileges to have their DNA sequenced and studied in depth like people who have private insurance. And we discovered this here and developed a program that's partially NIH funded, partially Texas Children's Hospital funded. So we address these disparities in genomic medicine so that we provide these services to all the underserved in the city of Houston. We're solving medical mystery for minority and underserved patients. Just in the first 6 months of the inception, this is a new program, we've solved 20 diseases that were unsolved in those populations. And this is in collaboration with Harris Health and Children's Hospital of San Antonio. Again, using really our secret recipe here, that's been great. I want to move now to other innovative therapies. You know, there's a revolution in medicine. We're finding the genetic lesions and causes for so many diseases, but we need to treat them. And some treatment will involve replacing the gene. And this is through a collaboration with Rice University. You can use focused ultrasound, which is uninvasive, just gently opens the brain barrier so that gene therapy would reach the brain. I just want to show you that really, when we're talking gene discovery, you really can lead to a trial. We have a great ongoing clinical trial treating one of those diseases now, and the next one that's happening pretty soon. So these will translate into therapies, and we can multiply that. A different kind of therapy that, again, will combine neuroengineers and neuroscientists and clinicians is understanding the brain network. And just as Google Maps will reroute you when there is traffic, if you understand the network and there is a lesion, you can stimulate a different part of the brain and make the patient better. And this was recently shown for severe depression and obsessive compulsive disorder by Dr. Samir Sheth, who just got published and got the cover of Biological Psychiatry. See, this is not any more science fiction. We can really modulate a brain network to help a person who's suffering a devastating disease. And the last thing I want to share with you is another use of focal ultrasound, which is high intensity, where you can fix a brain lesion without surgery. I just want you to see this video. This gentleman has severe tremor that keeps him from working well, can't really hold a cup. Without any surgery, just through focused ultrasound, now you can see his hand is steady. These are the kind of things we can do and really help people. And this is the innovation that you're seeing here in Texas. So I hope this convinced you that the time is really now to transform brain health research. And this is why House Bill 15 is so critical. Thank you.
Thank you very much, Dr. Zogby. It's amazing how far we've come in this field and really exciting to see all this important research that's being done here in the Texas Medical Center. Representative Senfronia Thompson was supposed to be joining us. She is delayed due to currently being on the House floor, introducing two bills. So we will move on to our panel speakers, and I would like to start with Mrs. Debbie Hanna, who is the president of the Darrell K. Royal Alzheimer's Research Fund and board member of Texas Healthy Brains Initiative. I'll start with your first, she's going to start with showing us a video, and after that I will proceed with some questions for you.
There's almost no one who is walking the halls of the Capitol or walking down the street who hasn't been impacted and touched somehow by some neurological condition.
Almost everyone knows someone whose life, including a lifetime of memories, has been unraveled by Alzheimer's disease, or a family that has suffered the loss of an infant or toddler to a rare, mysterious, and yet unnamed condition, or a teen facing the blanket of addiction.
Well, it's a terrible thing to happen to someone, and it's something that can happen to anybody, it can happen to me or you, so you hate to see your loved ones come down with it, but, until they come up with a cure for it or prevention, it's going to happen.
Enhanced and dedicated support of MBRIT will position Texas as a leader in the race to find new ways to detect, delay, treat, and ultimately prevent the devastating diseases of the last frontier of the human subject research, the mind and the brain.
It's a very, very forward thinking on behalf of the state to encourage collaborative research across research sites, because the research has to be multidisciplinary. We've got to have physicians, neuropsychologists, physiologists, neuropathologists, just a wide variety of professionals involved in this type of research.
Texas has the opportunity to invest significant dollars in research in this area.
When one can create an ecosphere of dedicated research that are all trying to solve a similar problem or a particular neurological condition, I think many times these successes will build on each other and ultimately certainly find their way to, a solution to something that we haven't seen before.
That's why this is such a rare opportunity. This isn't going to come again. We may not have this opportunity again. This state has excess of resources. What's the best way to utilize them? I submit this kind of research will pay dividends that will benefit all Texans.
If not now, when? If not Texas, where?
Thank you very much, Debbie, for that enlightening video. Let's get started with some questions. I think since we have not heard from our representative yet, it would be nice if you could first give us a little bit of background on the House bill that we've been discussing. So could you enlighten us a little bit on what the bill is and where it is currently?
Yes, I will. Thank you for this opportunity, Rolla. It's so far been very, very encouraging, and I'm very excited to be part of this effort. Like all things in the legislative environment, I'm a firm believer that it doesn't matter where you start, it's where you stop that counts. And we started out in the House with this bill, HB 15, and the related resolution, because we're using money above the cap, out of the excess funds that will require a constitutional amendment vote by the citizens of Texas to create a dedicated fund of $300 billion dollars that would be dedicated just similarly to the research secret cancer fund. The bill came out of the House masterfully directed by Representative Thompson and Craddock, and on a voice vote, very unusual, with no opposition, a single amendment that related to psychotropic drugs and veterans. And Ms. Thompson accepted the amendment and moved quickly over to the Senate. The bill was picked up in the Senate by Senator Lois Kolkhorst, and she is the co-sponsor in the Senate. And we have not yet had a referral to a committee out of the Lieutenant Governor's office, which is our most pressing need right now, to get the bill referred out and some hearings in the Senator Colcourse Committee, which is Health and Human Services. And it's still April, so May is when the clock really becomes your enemy on legislation. So for those of you familiar with CPRIT, it does create this kind of research-driven fund that will be wide open to business and industry, academics, universities, medical schools, engineering, pharma. This is the dream come true for those of us who have pushed for the last 3 sessions for this bill. Ms. Thompson has been a leader, and she has been selfless in her approach, and we are just working hard in the Senate. And we will, through the video that you just saw, we have 3 others. We have Mr. Craig Benson, who was the first speaker, started the Beyond Batten Foundation with some extraordinary work having been performed for children that suffer from that condition, led in part by Dr. Huda Zogby and Baylor. Bobby and Jan Jenkins, a businessman from Austin, who were in the care of their 19-month-old grandson when he died of a neurological unexplained death condition. Tragic family circumstances. And then we have the Benson family story of their daughter, Christiane, who is now 21 years old and living with Batten's disease. So we have an ambitious social media campaign, email campaign that we're about to undertake so that we can begin to let Texas citizens and interested parties know about HB 15.
Thank you very much. You have answered partially a lot of the questions that I have for you, but I'm going to go ahead through them to see if there's anything additional. First, could you tell us more about Texas Alzheimer's philanthropy?
Well, the Alzheimer's Texas is an office in Austin, Texas, and we have since, I'm going to say about 2005, been the leading voice, advocate voice for funding of Alzheimer's research in Texas. We started out with a very small, I call it budget dust, appropriation of $2 million to organize what is known as TARC, Texas Alzheimer's Research and Care Consortium, of which Baylor, UT Health in Houston, and 8 other medical schools are all members. So far, we have advanced about $69 million to these 10 schools. I know that's not a great deal of money in the research world. We have another $9 million coming out of this current budget. And then the DKR Fund is a private philanthropic organization named in honor and memory of the iconic football coach, Darrell Royal. And from private endeavors, we have raised about $7.5 million that we have churned back into grants, research grants that are awarded on a juried basis. Our jury is led by the esteemed Dr. Ron Peterson of Mayo Clinic, and most recognized for having been President Reagan's physician from diagnosis to death. And so we have pushed out about $6 million in research funds to almost every medical school in the state of Texas. We, including 2 grants to the University of Texas at Austin that are not part of Dell. So we have worked in our own environment, and we do everything we can at the national level to bring attention to the beautiful minds in Texas and the spirit of Texas that is exemplified by the video you just saw and Matthew McConaughey's great comment. And we think, if not now, when? If not Texas, where? And let's do it.
Thank you. And the last 2 questions I'll put together. Could you please tell us more about this Healthy Brain Initiative for Texas, and what does the pathway forward to the Senate look like?
Well, the pathway forward to the Senate really depends on community leaders, influence leaders, and decision makers reaching out to their senators. For those of you taking notes, the most important people in our life right now, our healthy life at the Capitol, is Lieutenant Governor Dan Patrick, Senator Lois Colcourse, who picked up our bill, Senator Joan Huffman, who is chairman of the Senate Finance Committee, Representative Dr. Greg Bonin in the House is the chair of the House Appropriations Committee, he is a neurosurgeon located in your general area geographically, and he is also an additional influencer on this bill. So reaching out to those decision makers to prompt a speedy referral to Ms. Colcor's committee and hearing so that we can bring forward people such as those esteemed individuals on today's call to testify in the Senate and bring about the sense of urgency that is needed to pass this bill out and get it into the conference committee and to Governor Abbott's desk.
Thank you very much.
You're welcome.
We're going to move on to our next panelist, Dr. Harris Eyre, who is our fellow in the brain health at the Baker Institute. He's a senior fellow in brain capital with Meadows Mental Health Policy Institute, also adjunct with the University of Texas Health Sciences Center at Houston. Dr. Eyre, Harris, could you please tell us a little bit about the brain health program that you are leading at the Center for Health and Biosciences and why this is important to you? Why do you think brain health is important?
Well, thank you so much, Rula, and thank you to all of my co-speakers and co-panelists, particularly Ambassador Satterfield and President DeRoche. I apologize in advance for the noise behind me. I'm in Denver at the City Summit for the Americas, which is a State Department conference that's with mayors from all the countries around North and South America, actually here talking about brain health policy at a city level, which is relevant to this presentation and webinar today. But so Rula, I think brain health is an important construct because we're a little bit stuck at the moment, right? With mental health rates are rising, rates of depression and anxiety and suicide, and on the neurological side, Alzheimer's disease is a significant challenge now, and it's continuing to get more significant. And I think that whilst there is good work in these areas of mental health and neurology, we need kind of a fresh approach. And I think that with brain health, we can think about not just how depressed are you, how impaired is your cognition. We can also think about strengths. We can think about how resilient are you, how creative are you, how wise are you, and we can sort of look at these things in a more holistic way. So brain health is a kind of transformative construct that really allows us to think across the lifespan about the brain. It allows us to think about prevention more and allows us to have a little bit more hope and positivity. And Rula, I personally am interested in brain health for my own condition. I live with migraine and visual aura. And for many years, since I was a teenager, I've been living with this. It gives me visual disturbances and horrendous headaches and nausea and vomiting. But now in the last couple of years, I have this new medication that's very effective for me. And so I now only get the visual problems, but I don't know what causes these migraines. So brain health for me, I like it because it can allow me to think more optimistically about what I'm dealing with. And I realize that these migraines for me have been a kind of superpower over the course of my life. It allows me to have a lot of empathy for people that have conditions that can't be explained by modern medicine. And it's meant that I've been extremely team oriented when I do my work. So I never want to be sort of the guy that lets the team down. So in my work in academia and policy and in business, I'm always working in teams, and it's a way of, I think, getting things done faster and at a higher quality. So for me, it's been very positive. So I hope that explains, Rula, why I think brain health is a useful construct for Texas and then also for myself personally.
Thank you very much, Harris, for that. I would also like you to comment on why you think the Baker Institute is an ideal place for this kind of work and what your vision is for the brain health program in the coming years.
Great question. Look, I think that the Baker Institute in Houston is really probably the best platform to try to build something really big and creative in brain health. The Baker Institute has convening power. It has policy chops, not just in health and bioscience, where you're leading things, Rula, but also across other areas like digital. We can think about the role of social media in the brain. We can think about environment issues like air pollution in the brain. So Baker has this kind of breadth of policy thinking, and it has allowed me to really broaden my horizons outside of just health policy, linking health to these other areas of society and of government. So I think that's wonderful with Baker, but then also Baker's co-located within Rice University. And as President DeRoche presented, Rice has a wonderful neuroengineering program. They, of course, need lots of policy help because there's concerns that whilst neuroengineering can be used for good for helping with rehabilitation. It also has dual use, right? It can be used for super soldiers and by certain nation states, which we shouldn't name, can use it for bad, and they may end up developing superhuman type technology. And so it creates this ethical and policy and regulatory dilemma with the US. Do we try to outcompete and go into these areas of human performance enhancement and sort of superhuman transhumanism, it's called? Or do we try to regulate these other countries and we all try to have a bit more of a responsible, ethical approach to building these technologies? So anyway, that's just my spiel on neuroengineering policy, but Rice is great. And then of course, within the Texas Medical Center, we have access to the best scientists like Professor Huda Zagby and such. And then finally, I would say that the Meadows Mental Health Policy Institute is obviously a leader in mental health policy, and the Hackett Center for Mental Health Policy is linked very closely to Meadows. And so we have all of this around Baker. So we can really, I see then finally in conclusion to say that the community is so tight-knit in Houston that it allows us to build something really big with a lot of different stakeholders, so it can become compelling as opposed to other parts of the world where things are more siloed and the community is not quite as tight. So it's very exciting to see where this can go in the future.
Thank you very much. Let's move on to our next panelist speaker, Dr. Stephen Wong, who is the Dunn Presidential Distinguished Chair in Biomedical Engineering at the Houston Methodist Research Institute. Thank you for joining us, Dr. Wong. I would like for you to please let us know what advances that you see in the neuroscience field which make you excited coming up.
Well, just too many to mention. I think Reggie already mentioned a lot of exciting things. I think the area like I pick a couple of them, for example, like neurofeedback, the real-time brain imaging signal to help people how to regulate their brain activity, treating like ADHD, anxiety, and depression, one of them. And brain-machine interfaces, a lot of people play around the devices that help people to with motion disability to regain control. And but the more immediate thing, these are more research at the moment. You take a long time to go through the clinical trial, get approved. And the reality is the closest things I see will be precision medicine. And basically is advanced genetics and all kind of information we have, and to develop a target therapy, personalized, optimized the treatment for individual patients in mental health or disorders. And this is one of them. The other area is really, end of the day, we still need to know what causes disease and how disease progression, so we can better treat the patient. So the new so-called system biology approach to decode the very complicated neural networks and molecular pathway, they can help us to find better drug treatments and intervention. Those are very cool things. And the other area people probably forgot, actually, we have a lot of microbiome in your body and also in the brain. And how these microbiome they're interacting with our brain, and we've known that they play a lot of brain functions, including mood, cognitions, and behavior. Understand this microbiome in the brain, the viruses, the bacteria in the brain, maybe give up a better treatment and a lot of mental health disorders type of thing we can do. So there are many things. By end of the day, I think I have to mention that today we're talking about all these exciting things is all these devices generate a lot of data. All kind of data we kind of unimaginable in the last century. And suddenly we come up together. And fortunately, recently, the AI and big data really helps to make sense of this vast amount of data, such that we can pinpoint to the more predictions and better treatment. So the way I look at it is together, device improvement, understand the biology, but all these really engineered by artificial intelligence and machine learning, make it more focused and optimized for individual patients.
Thank you. I think you just commented on part of my next question, but I'll see if there's anything you'd like to add. But what is the role of big data in advancing brain health?
So big data is quite a abused term, by the way. So
that would be nice, I think, if you could define it first. So people
it's hard to define. I think it's a moving target. And the 21st century medicine, the big data itself is at the scale of depth and breadth. that we, beyond our imagination, if I live in the last century. Right now, we're dealing with electronic medical record, we have MRI, CT, we have pathology image. But we also have a lot of patient videos, speech, motions tracking, body sensing, and all kinds of genomics that Huda mentioned earlier on, and even socio-economical behavior data. All these become digital form at our disposal, and which is very important. That's the reason why big data become very important in advancing brain health. In the past, we never imagined we have all this information. Now we need to put them together and digest them, make them into good use. That's the challenge. So your question is big data. So in terms of a role of big data and advanced brain health, that's your question, right, Rona?
Yes.
Yeah, I think if I probably reinforce what Reggie and Huda had mentioned early on, really understand the cause and mechanism of the brain disorder. We try to understand why causing it. And now we have brain function, structure, physiology, emotion, behavior. With Alzheimer, Parkinson, post-traumatic stress index, post-traumatic stress disorder, anxiety, schizophrenia, all kind of things. Now we really have a lot of information, help us to go deep to understand the causes and the disease progression. And again, I think all these, we can do better prediction on individual risk or develop a mental health disorders or brain disorders, and whether certain intervention will work. And thirdly, I think the personalized treatment, as I mentioned, this century is really not a bulk anymore. We do a optimized individual treatment effectively. Our human body is very complex. So, but now we have a lot of information that help us to focus. The large amount of data that help us to focus on individual optimized treatment. That's doable. We have smart algorithms like AI or machine learning. And lastly, the neuroengineering tools Reg mentioned and neuroinformatics tools. These are new tools come online, but I don't see it right away. It takes time because these are tools hinging on we understanding the underlying biology, why this tool will be effective. We use a lot of tools. Engineering, we like the tinkering, but science, we want to understand why it works. And to be effective, these two had to merge together with big data to be effective. And these two will be using for detecting, monitoring, and treating brain disorders, and in fact, give us a better brain health, not just enhance our health, not just a disorder, the way I look at it. So a lot of excitement of this era, of this 21st century medicine.
Thank you, Dr. Wong. The final question I have from your perspective, how would House Bill 15 support Texas?
Oh, very straightforward, right? All the research we're talking about, we research need money, nothing will happen. And all these are all ideas if it's no funding to make it happen. So one right away is really about the thing. So as an example, in Methody, we do a project on look at the, so just side issue. We miss a lot of stroke reality nationwide come to the ER room because a lot of subtle, all these things. And right now we're using patient facial video and speech. We actually do a study in AI. We do an app. In fact, the performance better than ER doc in preliminary study. And right now we try to extend it for a large clinical trial in telestroke. And all these approached, we can do a small scale, but you can see this technology, a platform, can be applied to other mental health brain disorder when there's sufficient funding. So right now, individual institution, academic institution, we do a kind of piecemeal, one by one, not quite coherent. A big initiative like this will gel a lot of people work together, solving a bigger platform. Everybody have an individual platform, but they have not been integrated together, solve the problem yet. So I see the golden opportunity to really develop new approach, new platform, integrated platform to hit many, to scale up whatever we do. So it's very important. And also at the same time, I think it also will educate a new generation of researchers and clinicians. It's very important to people who take up this new skill set. And I think the initiative may help a little bit also. But remember, also all these technology are talk about telestroke, telemedicine. Actually, one implication, it will help the care to pass the hospital wall. The care can access for the remote area, underserved area, that in the past people had to travel here. You don't need to. With this technology, you can virtual presences. All these will improve the outcomes for the brain disorder individuals and also the mental health conditions. That's what I'm thinking about. All these, I'm excited to have a infrastructure to make it happen.
Thank you very much, Dr. Wong. It appears that Representative Thompson is not going to be able to join us, but we do appreciate all the hard work that she's doing in the Texas House. So I would like to go ahead and address a question from our participants. It has been partially answered, but I can ask possibly Mrs. Debbie Hanna to address. The question is, can someone write a sample template of a message to send to important people in the Senate, and who to send it to? We can send around through social media to encourage people to reach out. I think that's a very great question. If you could discuss briefly, Debbie.
Sure. Yes, by Monday, we will have a PR package that's available. And if you can, out of your office, share my email with all participants freely, and those people watching, we will make sure that they receive the PR package, which includes the 4 videos. Starts with the Willie Matthew video, and then the 3 family videos. And then we have the social media posts for both, set up for both Instagram and Facebook. They will have, we're working right now on hot links that will direct you to the 3 senators and the Lieutenant Governor's office that I mentioned. And then we will have templates for things that you can send out, and little spots to insert personal observations about the sender's unique interest in brain health and funding. We think it's important because by this time of the session, the voting members have received literally hundreds of identical emails. And so we want the people who use this approach to personalize for their particular senators. And of course, it never hurts to write an email of thanks to Representative House Member Senfronia Thompson. And also, I might add, which I forgot to say earlier, very important, this HB 15 is listed by Speaker Dade Phelan as one of his top 20 legislative priorities of the session. That's very important. He assigned it a very low bill number, 15, which moved it quickly. And so anyone can communicate with me by email, and I will make sure our PR team reaches out to them on Monday.
Thank you. We have another excellent point from our participants. Most of the focus here has been clinical and health policy, but I was wondering about connections to education, since many of these mind-brain differences occur in childhood and impact schooling. And yes, a big focus for brain health is early childhood development. And even in our Center for Health and Biosciences, we have partnership between Dr. Eyre and our fellows who are working in early childhood development. And in my introduction of Representative Thompson, I was going to point out that she has a strong background in education as a teacher, and as such recognizes the significance of early childhood development and education. I will ask Dr. Eyre to comment further, please.
Wonderful. Thanks, Rula, and great question, Simon. Obviously, education is critical for people's future as individuals of Texas, and then also it's critical for the economy of Texas, right? We know that the economy is getting more and more knowledge intense and intense on the brain and mind. And so, you know, focusing not just in clinical and health as was pointed out, but in education is critical. So to put a finer point then on that is to say, of course, what disrupts education, things like, you know, autism. So it's important to understand autism much better, dyslexia, these constructs, sort of neurodivergence. How do we help neurodivergent kids to get better engaged in the education system? And then, of course, you know, we know that anxiety and depression is massive amongst the youth of America and the youth of Texas. And so how do we make sure that schools have the appropriate level of sophistication and access to services so that kids in schools can get easy support when they're struggling with anxiety and depression, because we know that that affects their ability to get educated, their ability to sail through and finish high school and go on to university. So absolutely, education is critical to us as we think about brain health and how to build the brains of Texans over the coming decades.
Can I make a quick comment?
Yes, please go ahead.
Actually, from an engineering point of view, I think the AI, machine learning, all these things will be automate a lot of mundane manual job, including manufacturing. So that's really raise a very good question. It's a next generation education curriculum. As Harry say, how it will be more knowledge intense, such that a machine cannot replace us. So it's a very interesting point. How to do that, I'm still struggling. What's the next curriculum will be like? All these things is open question. It's coming. We know that. We are not losing manufacturing. Actually, if you look at statistics. In fact, we are manufacturing so efficient. We automate so much that we don't need so many people in the fall. Just like happened to our agriculture business before, industry before. The same happened to manufacturing. Now what's the next industry? Will be interesting. I think the brain health initiative will possibly create a new industry if we going forward as a side effect. I got present side effect. That's why I'm thinking about it. I'm more optimistic.
Thank you. Yes, I do think that understanding brain function, of course, will contribute to our ability to improve education. And so this is early childhood development is really critical in the area of brain health. I am going to bring things to an end. I'd like to thank you. I'd like to thank all of our speakers and our panel members for being with us today for a very stimulating and exciting conversation. To learn more about this and other of the exciting critical public health issues that we're working on at the Center for Health and Biosciences, please join our mailing list so you can learn about our research and about upcoming events and become a member of the Baker Roundtable. Thank you very much for joining us, and we look forward to hopefully a successful legislative session.
Thank you.